Good afternoon, friends. I am Dr. Girish Khurana from Delhi, and today I will highlight upon some of the important topics which usually are missed in our clinical practice. And these points which I am going to talk upon is about bone, gonads, and thyroid. We all know the various complications of diabetes which happens with the disease at later stage of the life, but the important points which we usually miss is bone, which should be evaluated at appropriate intervals, because bone marrow density is affected not only by diabetes. Bone health is not only affected by diabetes but also by the various anti-diabetic drugs which are being prescribed by all the physicians. So we should look for bone health by looking into various bone index and key parameters of questionnaires of fracture index, and we should be aware of the drugs which leads to bone fractures like glitazones and some effects of SGLT2 and other drugs, insulin, etc. Similarly, patients who are on diabetes, they should be screened for thyroid dysfunction at the very onset of the diabetes, because subclinical hypothyroidism is also known to cause various diseases on kidneys like nephropathy and retinopathy, and it can be corrected by replacement with thyroxine, and we can prevent these complications. Moreover, it also leads to better glycemic control. Similarly, patients who come to our clinic, and they should be evaluated for their testosterone levels at the very onset, and patients who have symptomatic diseases like erectile dysfunction or loss of libido or fatigue, or patients who are anemic, after evaluating all the causative factors, they should be screened for testosterone, and testosterone replacement therapy should be given in such patients who come with the symptoms of hypogonadism. Also, these patients, they should be screened regularly after appropriate intervals, and patients who are hyperthyroid, once they are on insulin, the dosage of insulin needs to be corrected once their hyperthyroidism is controlled. So the idea is that not only HbA1c, we should also look for these parameters which are also a part and parcel of the complications and in management of diabetes. Thank you.